This, more than anything, is where we need your help.
A plea from Danny Hill.
In our view, the biggest problem and the real opportunity for solution sits in reforming our call taking and dispatch process.
The union says too many emergency paramedics are being sent to non-urgent duties.
AV would tell you that the call taking software used in Victoria is used by 2,000 ambulance services around the world. This is correct, but only in Victoria is the ambulance call taking not performed by the ambulance service but by another organisation who don't employ clinicians.
A parliamentary committee has been investigating Ambulance Victoria.
We have enough paramedics to handle the emergency workload, but we do not have enough paramedics to handle both the emergency workload and all of the additional non-emergency work our members are asked to deal with every single day.
In 2024, the number of paramedics thinking about leaving the profession had risen to 57%, up from 39% just 4 years earlier.
The job's just not what it used to be. And as a result, the people who suffer the most are the patients.
Evidence shows 1 in 3 emergency patients in Victoria do not get an ambulance in time.
There is now over 100,000 Code 1 cases per quarter, and only 65% of patients get an ambulance on time, and it'll probably get worse.
The Upper House inquiry received 189 submissions, a disconnect between senior management and frontline staff identified as one of the issues.
We've had 6 CEOs in the last 5 years. How can staff have trust in leaders when they keep changing?
We can't lead the cultural change in isolation. This is something that we have to do as a team.
The Emergency Services interim CEO says he's been listening to staff and their key concerns.
Rostering, flexibility, leadership stability, uniform representation at the executive level, call taking and dispatch, corporate support, pay slips, culture and behaviour.
Pressed for answers on communication upgrades.
The rollout of digital radio across regional Victoria is a priority and will be completed by the middle of 2026.
So you can guarantee it'll be complete by middle of 2026?
That's right, yep.
Okay, guarantee.
What sort of technologies are you focusing on, whether it's physical or software-based technologies, to make the work of paramedics easier and more, most importantly, I guess, more effective?
The iPad is a very good example of a tool that we've put in place that is designed not only to be able to make their life easier, but to make information accessible to the entire workforce.
Despite the success in some areas, challenges remain.
Mission 163 noted that pay slips are hard to decipher and do not contain adequate information. Do you agree with that?
Absolutely, and we've heard that message from our staff. And we have a board-approved project which will kick off in July called Project Synergy.
When stories of discrimination, sexual harassment, bullying and victimisation emerged, an independent review of workplace equity at Ambulance Victoria made recommendations on working conditions, governance and accountability, and the workplace culture.
How effective do you think the organisation has been at getting on the journey to change?
The effectiveness from what we hear is different in different places throughout the organisation.
Senior management says it's committed to learning from the parliamentary inquiry.
We acknowledge the well-documented challenges facing the organisation. These are not short-term issues, are not quick turnarounds, and we are actively addressing them with a long-term view.
Various other Ambulance Victoria directors, the Health Department, unions and health services have also given compelling evidence. The Legislative Council Legal and Social Issues Committee has until October 2025 to present a report to Parliament. It will have findings and recommendations for the state government to consider. Check out the website for the full public hearing transcripts, submissions and all other information.